everyone. Did you guys still visiting your friend's house or attend any annual dinner? If yes, let me tell a little story. Have you all heard of this infectious disease? Yes, this disease is infectious, but the disease has long existed in our country. However, recently the disease has increased with more violence, especially to children. By the way, my name is Nur Naziha binti Zahari and I'm from class KBA 1183F. And I'm from an office management course at UiTM Merbau. Today, I would like to inform that there is an infectious disease which is hand, foot and mouth disease, which is we calling HFMD. This disease has a negative impact on patients, especially children and babies, because they are among the most susceptible to infection. Based on article I found in the Malaysian server, Malaysians have recorded 57,510 cases of hand, foot and mouth disease involving children aged 6 years and below. That's from 1 January until 25 May this year compared to last year. Health Minister Khairi Jamaluddin Abu Bakar said the 24-fold increase was reported in Kuala Lumpur and Putrajaya during the period, with alarming levels in April this year, and he also said the increase in HFMD cases was due to movement after the reopening of social activities, school and negligence in terms of hygiene among parents and caregivers of children. I need your attention right now because here I have list a few of effects of HFMD. First, your child will have a fever with a blistering rash on the hands, feet, mouth and tongue. Okay, second, loss of appetite because the mouth is full of ulcer, causing difficulty in swallowing water or food. Okay, third, it can even cause respiratory tract infections, causing many children to have difficulty breathing when infected and may experience diarrhea. Here, I attest an age class by child for this disease.
Okey, so virus HMD ni dia ada pada cecair hidung tekak, hingus, air liur dan daripada cecair daripada blister lepuh, daripada blistering cecair itu. So virus ada pada kawasan-kawasan tu, cecair kawasan tu dan najis sekali. So dia senang berjangkit bila seseorang dah sentuh cecair itu, in contact dengan cecair itu dan sentuh anak-anak lain, termasuk bagi dia makan, sentuh muka, mulut, hidung, kongsi straw, kongsi utensil.
Mungkin dari alat permainan kanak-kanak
ni. Sebab virus boleh duduk kat permukaan alat permainan dan bila budak lain datang sentuh permukaan, dari situ mereka sentuh mulut, hidung, dari situ jangkitan tu boleh didapatlah.
Semudah itu ya?
Semudah itu. Almost 100%.
Problem is hand, foot and mouth disease, HFMD. HFMD is a disease caused by virus infections, especially Coxsackie types A16 and enterovirus 71, which is a separate direct contact with nasal fluid, saliva, blister and feces of the sufferer. Usually, those who are infected, especially children under 5 years, will show one or more signs such as fever, ulcer in the mouth, rash or blister on the palms of the hand and feet. HFMD usually causes a mild infection and heals on its own. Nevertheless, a handful of HFMD infection caused by EV71 infection can cause complications such as inflammation of the brain and heart. In addition, This infection also occurs due to not practicing good personal hygiene or being in a crowded environment. The solution is wash your hands with soap before preparing food, after going to the toilet, changing diapers, and washing stool. Next, cover your mouth and nose when coughing and sneezing in the public, and please discuss the tissue in the covered bin. Not only that, it is recommended to give paracetamol to patient in order to reduce the feeling of fever, and make sure get enough water. In addition, it is necessary to clean toys, chair and table that they are contaminated with the child saliva. Do not share clothes, towel, food, beverage and toys. Always aware to the effect that shown by the child if they do not want to eat or drink. Children suspected of HFMD should be quarantined and not sent to school or to public places.
Hand, foot, and mouth disease. HFMD is a contagious viral disease that affects children under the age of 10. It is caused by the COM165 virus. The virus spreads through contact with unwashed hands, surfaces contaminated with feces, and infected persons' stool or respiratory fluids. This disease is self-limiting and goes away on its own within 7 to 10 days. However, there are some home remedies that can help your child tackle this disease. Home remedy number 1. Tender coconut water. Coconut water cools the body and is gentle on the stomach. It contains a wide range of vitamins, minerals, electrolytes, and antioxidants. Giving coconut water to a child with HFMD can relieve the pain in his mouth and keep his body hydrated. Home remedy number 2. Oil pulling. This is an Ayurvedic method for maintaining good oral hygiene. It also helps soothe the mouth sores caused by HFMD. Take a tablespoon of any oil like peanut, sesame or coconut. Ask your child to swish it around in his mouth for 5 to 10 minutes and then spit it out. Home remedy number 3. Cod liver oil. Cod liver oil contains vitamins A, D, and E. It boosts body immunity and has antimicrobial properties. It is a good remedy for HFMD. It can be given to a child in the form of capsules or by mixing the oil in a juice or yogurt. Home remedy number 4. Salt water rinse and baths. Ask your child to rinse his mouth with warm salt water 3 to 4 times a day, as it will provide him relief from painful blisters and mouth sores. Also, adding Epsom salts to his bath water can soothe the rashes on the body and help a child heal faster from the HFMD symptoms. Home remedy number 5. Garlic. Garlic has strong antimicrobial properties as it contains high levels of sulfur compounds. You can include garlic in the food, give it in the form of capsules, or make a herbal tea by boiling 3 cloves of garlic in water. Home remedy number 6. Elderberry. Elderberry is well known for its antioxidant properties that boost immunity and help improve resistance to diseases. It helps the body produce mucus to fight viruses. Make an elderberry and honey syrup and give it to your little one frequently to help him heal faster from HFMD.
Finally, this infectious disease is very easy to spread to people around. The most important thing is to keep the environment clean. Wash your hands regularly with soap and do not share food or drinks that involve saliva, as it is very easy to spread. And the disease has importance in daily life to sake of loved ones and yourself. The public needs to be aware of this infectious disease, as cases in Malaysia have increased dramatically after the Aidilfitri holidays. This disease will have a negative impact, especially on children who still do not know how to walk, because they are in excruciating pain without being able to tell their parents. Therefore, always take the disease seriously. Even if within a week it will disappear, but during the period, the suffering experienced by the patient is very painful. Okay, that's all from me, and thank you for listening.